Generalized Anxiety Disorder by Teresa Doheny, Shellen Pint, and Zach Carhart. Generalized anxiety disorder, also known as GAD. The central feature of generalized anxiety disorder is worry. Symptoms include excessive, uncontrollable, and long-lasting worry, inability to let go of a problem, interfering with daily life, difficulty concentrating, tiring easily, restlessness, irritability, and muscle tension. GAD data, the onset age is adults, usually between 35 and 45. It's the most common anxiety disorder in adults aged more than 55 years old. Without treatment, remission is unlikely. 83% of patients present with another anxiety disorder and or coexisting depression. Retrospective studies suggest that GAD is a chronic condition with an episodic pattern in which periods of relapse and remission are evident for up to 20 years. GAD treatment. The SSRIs are advantageous for treating GAD as they are well tolerated and also effective against the comorbid psychiatric disorders seen with this condition. There are 3 effective SSRIs in treatment for GAD. One is called escitalopram. There's pregabalin and venlafaxine. The first one, 20 milligrams was superior to a placebo, according to the Hamilton Anxiety Rating Scale. The pregabalin was superior to the placebo in relieving acute symptoms of GAD, and the venlafaxine showed a significant improvement in response and remission rates compared to the placebo. According to Lamb 2006, remission rates are an important indicator of treatment success as they show the proportion of patients who fully recover rather than the proportion of patients who simply experience clinical improvement in symptoms response rate. Relapse prevention in GAD. According to a recent study, relapse was almost 5 times higher in placebo patients than those being treated with an SSRI. This, together with the known chronic nature of GAD, means that long-term pharmacotherapy is needed for most patients. Psychotherapy treatment for GAD. Various forms of psychological treatment, including cognitive behavioral therapy, have also been evaluated in the acute, long-term, and relapse prevention phases of treatment of GAD, and there are data to show that this approach may be beneficial, especially when used in combination with effective pharmacotherapy. In a recent study, cognitive behavioral group therapy was used as a treatment for GAD. There were 37 women, 15 men. Each individual was presenting with a primary diagnosis of GAD. Group therapy, CBT treatment, was given 14 weeks, 2 hours a session with 2 clinical psychologists. They measured the anxiety disorders with the ADIS-4, which assesses all anxiety disorders and screens for various other disorders. They used the Penn State Worry Questionnaire, the Intolerance of Uncertainty Scale, the Beck Anxiety Inventory, the Beck Depression Inventory, and the Social Adjustment Scale. The treatment response was participants no longer were meeting GAD diagnostic criteria after group CBT therapy. 60% no longer needed or no longer met criteria for GAD after post-treatment, 88% at 6 months, 95% at 24 months. And according to King, Johnson, Davison, and Neal 2012, anxiety disorders are also highly comorbid with other disorders. 60% of people in treatment for anxiety disorders meet the diagnostic criteria for major depression. 80% of people with a diagnosis of GAD will meet the diagnostic criteria for another anxiety disorder. There's also support for the idea that people with GAD may be avoiding emotions. Relaxation techniques can involve relaxing muscle groups one by one or generating calming mental images. With practice, clients typically relax rapidly. And exposure treatment is the most well-validated psychological treatment for anxiety disorders.
In addition to Teresa's research, I consulted the DSM-5 to gather information on GAD, along with 2 studies that focused on the treatment of youth and adolescents with GAD. The diagnostic features listed in GAD diagnostic features of GAD as listed in the DSM included excessive anxiety and worry about a number of events or activities. And these worries would interfere with psychosocial functioning. Duration and intensity of worry is out of proportion to the anticipated event. And worry is so intense that it interferes with daily tasks. An individual with GAD may have symptoms that include restlessness, feeling on edge, easily fatigued, difficulty concentrating, mind going blank, irritability, muscle tension, and sleep disturbance. Adults tend to worry about everyday tasks and responsibilities, like including job responsibilities, personal health, finances, health of family members, misfortunes to their children, household chores, being late, those kind of things. Younger adults experience greater severity of symptoms than older adults. Children worry excessively about their competences or their quality of their performances in school and extracurricular activities, and the focus of worry shifts from one concern to another. The development and course of GAD, as described in the DSM, are that most individuals report feeling anxious and nervous all of their lives. The DSM-5 stated that the median age for onset is 30 years old. Prior to this age, symptoms of excessive worry and anxiety may be present, but they're likely to be manifested as an anxious temperament. Females are twice as likely as males to experience GAD. The symptoms tend to wax and wane across the lifespan, peaking at middle age and declining across the later years. Rates of remission are low without treatment. The earlier in life that symptoms are present, the more comorbidity that the individuals tend to have, and the more impaired they're likely to be. Risk factors of GAD. The temperamental risk factors include behavioral inhibitions, neuroticism, and harm avoidance. There are some environmental factors that have been associated with GAD, such as childhood adversities and parental overprotection, but no environmental factors have actually been identified as specific to GAD. 1/3 of the risk of GAD is genetic, according to the DSM-5. In 2016, a study titled Anxiety Sensitivity and Its Factors in Relation to Generalized Anxiety Disorder Among Adolescents focused on examining the link between anxiety sensitivity, or AS, and GAD in youth. After conducting the study on 165 adolescents between the ages of 10 and 17, the findings were that AS was significantly associated with worry and generalized anxiety symptoms, leading to a diagnosis. Overall, the study stated, findings suggested that AS, and particularly concerns about physical consequences of anxiety, may be particularly relevant to GAD-related outcomes among youth. Some of the integrative treatment options for children and adolescents included, I found a studies that integrated culture and pedagogy and humor in CBT with anxious and depressed youth. It found that the research supports the importance of the integration of cultural considerations as and the intentional adoption of the pedagogical principles and the use of humor in therapy as 3 possible conceptual and concrete innovative tools that can further CBT's effectiveness as treatment of GAD, along with other anxiety disorders. The authors held the belief that therapists of young clients or held the belief that therapists, young clients, and their parents come to treatment with their own ideas about psychopathology, well-being, and healing based on their cultural backgrounds, such as life experiences, education, traditions, views, and beliefs. And it's important to honor where the clients come from if we hope to benefit them. To continue the integrative treatment for children and adolescents, the authors also pointed out an important challenge when conducting psychotherapy with children is making abstract psychological concepts concrete, and humor has been identified as an effective tool in aiding and understanding. Children and adolescents may find that their problems and even their solutions are reflected in lyrics of songs or by characters in movies or books, and humor is not only increases understanding, but it also decreases resistance when it's implemented successfully. And it can unite the communicators and release tension. But when it's not applied appropriately, it can damage the relationship and harm the child. So when utilizing humor in therapy, it's important to always target the belief and not the child. Examples of the integrated therapies that this study highlighted were the Copycat program, which is one of the first evidence-based treatment manuals for anxiety disorders in children and adolescents ages 7 to 13. The manualized treatment program utilizes conceptual and concrete tools to make the treatment accessible. They used examples like exercises such as the robot and ragdoll exercise, where you get the child to act like a robot and then be really stiff, and then just release and be like a rag doll. The modular approach for treating children and adolescents, or MATCH, suggests ending the sessions with a leave them laughing activity. And so these fun activities help the child feel positive about what was accomplished in the session. And then MATCH also has evidence that supports the importance of retention when humor is involved during the session and not only at the end. So that's the information that I gathered from the DSM-5 and the articles on adolescence and culture and therapy for GAD. So here's Zach with a biblical perspective on our generalized anxiety disorder.
Philippians 4:6 states, "Do not be anxious about anything, but in everything by prayer and supplication with thanksgiving, let your requests be known to God." Seems simple, right? But why do a lot of people in the church and even outside the church struggle with GAD or various forms of anxiety disorders? Typically, people in the church just kind of give you a prescription to memorize one of these verses, such as Philippians 4:6, and say, just pray about it and you won't be anxious. Well, let's kind of put on the brakes, because it's not just that easy, and this disorder is not just cured by memorizing a verse. And also, we wanted to communicate that just because you're anxious or deal with a GAD anxiety disorder does not mean that you have a weak faith. McRae states that anxiety that is realistic is certainly not condemned in the Bible, but when it reflects primarily a lack of confidence in God's presence in the midst of our suffering, as well as a tendency to take unnecessary burdens and responsibilities, it becomes a focal point in pastoral care or professional interventions. So I wanted to include this statement because a lot of people in the church are guilt-tripped or shamed because they struggle with anxiety. And when they go to maybe their friends who don't know what they're struggling with, they kind of say, well, why don't you just pray about it? And that's, as we have seen, is not the right approach in dealing with people who struggle with GAD. Some other people just boil anxiety down to excessive worry. And while this may be true, there could be a lot of roots attached to why someone worries as much, or as we've seen, that it's part of your biological functions. So GAD is connected to a lot of it's connected to not just your spiritual aspect, but your biological aspect as well as a person. And in the church, sometimes I feel like when you just give a verse as a prescription, they're trying to have a quick quick fix of the situation, but that mindset of our culture has huge consequences socially, financially, and morally. And we have a collective pattern of avoiding conditioning and lack of willingness to provide the structures, support, supervision needed to bring lasting change. And in the church setting or a Christian setting, you should be able to rely on your church family, your close friends. But if we, as a body of believers, as a church, just deal with this quick fix fantasy and not want to like dig deep into the trenches, it's going to hurt the individual rather than help them. So coming from a biblical background to take a holistic approach, as we've heard, the first thing, if you're really struggling with this, is definitely go see a physician. And as Teresa was explaining, all the medications that can help and have been proved to help, that is not the end-all answer to these problems. It is one of the prerequisites that can get you in a healthier mind state to deal with your anxiety disorders. But we do need to be careful that medications are not is not a God. It won't essentially solve the problem. Another technique is relaxation techniques, as Shellen pointed out. And coming from a biblical standpoint, this looks like prayer and meditation. And as you'll see in the next slide, studies have been shown that prayer and meditation relaxation techniques do help people who struggle with anxiety disorders. Also, just to kind of go back, healthy self-talk and CBT are tied together in dealing with anxiety disorders. And also, I just lost the last slide, but that's okay. After going through the literature review, I found a couple articles that, as I said, pointed out the importance of devotion, meditation, and also centering prayer. So one study found that after treatment, participants in the devotional meditation condition reported less anxiety than did participants in the progressive relaxation control conditions. And another study, it said that centering prayer, devotion, and meditation has been found to improve Christian clients' struggle with anxiety and worry, depression, which helps them cope with health concerns. So as you can see, to be honest, there's not a lot of studies done from this standpoint and point of view. But what I found is that the research out there does indicate that we can, as Christians, be confident coming into it with a meditation and relaxation point of view, having our focus be on our faith that can help us with our anxiety, along with, as I said, the professional therapeutic roles of physicians and counselors. So that is the end of our presentation. I hope you all have learned something, and if you have any questions, feel free to leave them in the comments. Thank you very much.